All right, here we are. Welcome. I'm going to share a slide. Here we are. Just make sure you're in the right place. Even if you're not, you're welcome. So join us on, we are talking about demystifying AI with frameworks for incorporating AI into healthcare delivery for beginners. So I am Sarah Lampe. I am the president and CEO of PrimeHealth. Excited to have you all here. Just as a reminder, PrimeHealth, we foster innovation to improve health in underserved communities. We do this through acting in our three values: justice, community, and play. We support partners through convening, building and supporting capacity building, and ensuring that we all are able to advocate and educate around the needs of the safety net. You can see these are our three values we have here: striving for equitable and transformative opportunities for health of underserved communities, ensuring that there's collaboration, and then play. We really want to ensure we're imagining a future that is not yet known through creativity, curiosity, and courage. These are our team members. As I said, myself, Sarah Lampe, the CEO, Felicity Hughes is also here, and then Darby Fornacero, who is our operations manager. All right, so why are we talking about AI? We at PrimeHealth have had several opportunities since I joined about a year ago to have conversations with several of our partners, including our healthcare partners, our providers, and those in the startup and innovation community. And we're hearing two different stories about AI when we have those conversations. One story from our innovation community is that if you're not doing something in AI, you're not getting funded, or you are not actually able to advance your solutions. AI really is a foregone conclusion for those in the innovation community. What we're hearing then also from the provider community, or those who are working in healthcare, especially within the safety net, is they don't understand AI, they don't want to use AI, or in some cases, they're not allowed to use AI. And so we are here to have a conversation to really start from the beginning. What are some frameworks? What are ways that we can think about AI? And then how do we support each other to kind of build together in that chasm that exists between our providers and our innovation community? So I'm excited to have John Emerson joining us today. John is an AI expert, a partner, and our speaker today. He'll be providing us some great insight into some of the excuse me, some of the frameworks and the beginner thinking around AI. John is also going to give you all a chance for questions and answers and engagement throughout. So what I'm going to do is kick it to John. If you have any questions or anything that comes up throughout the presentation, please put them in the chat. I will be monitoring that and making sure we have questions answered at the end. We will have time. So take it away, John.
Thanks so much, Sarah. It's fantastic to see everyone here today. Before I get started, I am hoping that I can get folks to either come on camera or at least with a show of hands. I'm curious, are there folks here who are providers or who are working somehow in safety net organizations? Just sort of curious. Do folks know how to use the hands feature to wave, or so first is, are you a provider? Give me a hand wave or something. Anybody who is actually a provider on the front lines? All right. How about works for a safety net or is in support of a safety net organization? I'm guessing we'll have some hands there. Everyone's on mute too. All right, it's Nick. There you go. Great. And what organization are you with, Nick? Sorry.
Yes. So John, I advise a client who's working with the VA, and so I guess that does fall under safety net, and some of the demographics that they're targeting are in safety net population. So, yeah.
Gotcha. And is anyone not from Colorado in here? Just curious again, who's here and who's not? All right. Well, I will continue my conversation just to give you a little bit more about me. I have been in health tech. I got my first fraud, waste, and abuse training 20 years ago in San Francisco Bay Area. So I understand HIPAA and high tech and sort of how that policy has progressed. I'm also very dedicated to doing good in the state of Colorado. I served on a governor's commission here called SAPCA, Strategic Action Planning Group on Aging, which passed the modernization of the older Coloradans Act. And I helped set up COVID Check Colorado, delivering COVID testing and immunization to parking lots across the state using the mobile web and a reporting system which connected into state and testing labs, et cetera. So I have a background both in health tech as well as supporting the state of Colorado. And I most recently was the CEO of a company that I'll talk about, which was in this generative AI space. And really, if you think about my talk, there are three pieces. One is talking about my own experience. Two is getting folks to think about how they dip their toe into the waters of using AI more concretely. And the last is sort of starting frameworks for governance. And I'll go through each of these, and I'm happy to take questions as we go because it's a pretty small group. So let me share my slides. Let's verify that that's working, and we'll go from there. All right, can I get a thumbs up or two just to say, yep, you see things? All right, looking good. Okay, so traditional product or startup says, what's your pain point and how do you solve it? And, you know, I think this is a great one, right? With stroke, everyone knows the longer you wait for treatment, the longer you have between the stroke and the intervention, the higher risk of death and damage, et cetera. So up until 2022, this type of solution was all the rage. This is Viz AI. And what they do is they take thousands of pictures of the brain that are taking whenever you do an intake for patients, and they have that ability to quickly find out where is the stroke. In this case, what is the large vessel occlusion, right? Built on big data, FDA approved. This service itself is actually CMS reimbursed because it's proven that this reduces costs. An amazing tool. And this was really all the buzz. These types of diagnostic solutions were all the buzz until 2022. And Gen AI rolled in as a wave. And it wasn't just one solution, and it wasn't a clear pain point. It was, we can do almost everything. And this really, I think, has been a source of overwhelm for a lot of folks because it can do voice and answer the phone. It can text message, do amazing, generate new research papers. The list goes on and on. And the question is instead of being an entrepreneur who says, I know which problem I'm going to solve and I'm going to go after this and prove it, suddenly you could do everything. And quite frankly, I think in the safety net, right, the question is where is this going to affect healthcare delivery? I don't have tons of evidence. Everything we've done before this is evidence-based. To your point, Sarah, there's a fear of job loss. There's a fear of we aren't allowed to do anything. It's very, very similar to me to the early days of the internet or of social media. No one was allowed to touch social media at work, right? And now it's part of what's happening. So amidst this, as an entrepreneur, what did I do? I dove right in, right? And so the first company that I joined, rather than talk about what it was, I'm going to give you a quick demo. So let's hope that this works. I am shifting tabs and turning up the volume. Let's see if we can't make this work great. Full screen. Can you see my video?
Yeah, I'm happy to how can I help you?
Hey, I'm actually new to the area and I haven't gotten a cleaning in the past year or so and want to find a new dentist. And I also actually chipped my tooth a couple of weeks ago and wanted to get that checked out.
Hey there, welcome to the area. It sounds like you're looking for a general cleaning and possibly some restorative dentistry for your tips too. We can definitely help with that. Let's get you scheduled for an appointment. When would be a good time for you to come in for a consultation?
Yeah, I'm actually generally available during late afternoons. So probably tomorrow or the day after around 4 p.m. works best. But do you guys take Delta Dental by any chance?
We do accept Delta Dental, so that is great. How about we schedule you for a visit tomorrow at 4 p.m.? I'll go ahead and get that set up for you, and then we'll send you a confirmation text with all the details. Would that work for you?
Yeah, I think that's great. So they'll be able to check out my chip tooth during the initial consultation.
Absolutely. We'll prioritize checking out your tip tooth during the initial consultation. If it's urgent, we'll make sure to address it right away. We'll see you tomorrow at 4 p.m. Looking forward to meeting you.
So I'm not going to walk through the rest of the demo, but what you can see from this was we had two use cases that we were showing off. Can you all still hear me? Good, good, good. So we had an ability to both answer the phone, handle a very complex situation in a very human manner, including interruptions. By the way, do you take my insurance? By the way, I have another problem I didn't talk about. And then try and convert that into a type of appointment. And that could be a priority appointment, or that could be a normal appointment. So a bunch of capabilities on voice. And then we also had a text campaign. Now, this text campaign that I'm showing was focused on lost patients. And that was a big issue, right? The question is why did you leave our system? And in the most cases, you couldn't find out. You had permission to message them, but what we wanted to find out was what was the experience, and could we, through a conversation, convince you to come back after we found out, or did we need to contact you and say, gosh, that was a horrible experience? And so instead of being, here's the one problem I'm trying to solve, we had a host of capabilities that were given to us via Gen AI. And I actually think that most startups right now are seeing the same thing. Lots of use cases, lots of capability. It's an ocean of capability. The question is how do you prioritize and label those quickly? And as you'll see, this is a skill that isn't just needed for a startup, but it's really for those administrators and those who are looking at how do I help my organization get its hand wrapped around AI? So with that, I'm just going to show this was sort of a, our hypothetical way to say, what's the value for the org? What's the risk of a mistake in terms of the business risk if a mistake happens? And then how do we prioritize what we talk about? So here you can see in my demo, we talked about the lost patient campaign because it was ready. It was probably not as valuable as answering the phone, but it was also lower risk. Answer and schedule, probably the most valuable, but also I'll tell you a lot of organizational challenge around. Finally, I will tell you after going through these two, we went after the claims phone call as determining the long-term strategy for the company because no one likes to be sitting on phone waiting for an insurance company just to explain whether the person's eligible or why a claim didn't come through. But given all the capabilities of generative AI, there's a lot, and you really need to think through which ones you're doing, why and where the benefit is. And I think that this is a skill that all of us can learn how to do better. But it sets up this question of how do you get started as an individual leader of an organization? I'm going to make sure that this is actually full size again. And getting started as a leader yourself, I have two recommendations. The first is always find a tribe and join others to talk live. And that means not just sitting and watching a webinar, but getting involved and talking about use cases that you're using. This is a group that I'm a part of. I highly recommend. It's the Rocky Mountain AI Interest Group. I don't know if anyone here has attended any of the meetings. Right on. You'll note they haven't started a health AI subgroup yet. I have been working on that with some other folks. If folks here want to talk about that, we should talk about that, because I think that that's badly needed to not just be, as I said, not just listen to a webinar, but participate. And this group has, ethics and education and all sorts of groups. I find regularly going really helps me a lot. The second thing I recommend for anyone trying to get their toe wet is to find your guru. My personal favorite guru, I've actually led multiple book groups on this topic, is Ethan Mollick's Co-Intelligence. I would love to see anyone else read that book yet or looked at it. I recommend buying it. I give it away to a lot of folks. And so he's a professor at Wharton. He teaches a class where he encourages all of his students to use AI for the class. And as part of what he does, he actually did a study with BCG where he separated two groups of consultants to do the same task. And they had similar skills, right? They were people who were great performers, people who were average performers. And what he found was that the group with AI performed on average, maybe 20% better. I'm not specific on the percentages, but I will tell you what he found was the 50th percentile, your average performer, saw the most boosts in performance. And that, the finding therefore was, listen, all of us need to understand that AI can help us be productive, but we need to invite AI to the table. We need to learn that AI does hallucinate. There are inconsistencies. We need to be the human in the loop and learn how to manage and monitor. He tends to recommend that everyone spend 10 minutes on something that you know super well, and then look at the responses and say, aha, this is not quite right. This is right. But by focusing on that, you then learn how to guide AI, how to treat AI like a person, and then understand that even though it's not perfect now, it's going to be better. And my favorite sort of core statement of this book is there's a jagged frontier of possibility. There are places where it's so wildly capable that you can't not use it. And then there are places where it's so embarrassing that it's actually putting you at risk. And so it's navigating that jagged frontier that helps you as an individual understand AI and then open up yourself to thinking, how might I create a governance structure? And you can see he thinks about different tasks. There's the idea of the just me task, the tasks that you delegate. In other words, you'll give to AI to use, and then automated tasks. Personally, I will tell you, my number one use case has been was learning how to do Python for data science. I took an online course on how to do it. I had assignments I had to hand in. And yes, I could ask AI to just give me the answer. But the best part that I got out of it was saying, you are my teacher, and explain to me why this syntax is wrong, or explain to me why this error is this way. Explain to me how I would not just do this, but if I wanted to do this. And using it as a teacher or mentor has been amazingly helpful for me to learn AI more quickly. And I think everyone probably has an experience like this, but encouraging others in the community to do this, I think especially folks who are in the safety net and working very hard, they may not have done this yet, and it can be a great exercise. I think the third and most interesting aspect of this presentation in terms of frameworks is how would you go then as an organization to start some notion of governance? And this is messy, right? Because so far, if you look at what ONC has said, it's really not a lot of guidance in terms of HIPAA and high tech. I made this slide up from their word of faves. I don't know if folks have seen it yet, but the idea is correct. You want to make sure that AI is fair, appropriate, valid, effective, safe. The question is how does that turn into something that I could actually use for my organization? And frankly, my experience in working with compliance groups frequently is that a lot of it is don't do that, it's too risky. And given the fact that, quite frankly, most of your employees are probably using it privately, you've probably used it privately, the notion of don't at all starts to seem, well, just like saying to folks, you're never going to use social media. That they do end up using it, and the question is, how do you use it better? A different framework that I think you need to have the faves framework in mind when you're building something, but I would recommend another group called govai.org as a great place to look at. I don't know if folks have ever heard of this group before, but they started out from San Jose. There is someone from Colorado's financial department, the CIO of finance, I think, in the state of Colorado is involved with this. What they've said is, we want to make it easy for your smaller county and city administrator to figure out, how do I have a policy? And there are sort of 5 pieces to it, right? On the front, it's a statement of policy. And on the back, it's an instant response to say, what's our backup if thing goes wrong and how are we going to respond? But in the middle, it is this nutritional set of 3 things, looking at AI use cases, your AI vendor that you're using, and then what is your agreement? And by building out, and by the way, what they do is they'll provide templates, or they'll publicly show templates that they've used elsewhere and say, this might be a good place to start. When you do this, I'm going to show you some examples of their templates. But when you do this, let me first say, remember when you're looking at your organization to look at everybody. So when you're looking at use cases they're used, where people may be using AI already, remember it can be across clinical operations and finance and patient admin and engagement, all sorts of areas where you need to sort of try and say, what are people using now? And what are things we might want to consider in a policy? And then the meat of it really is looking at, how do you do these vendor assessments? This was my favorite one, because someone said to me, I cannot use a translation service. This is true in healthcare, Denver Health, everywhere right now. You don't want patient data to ever touch a server such that it can't be used in the model. Most people use live voice translation to today. I was very curious to say, is there anywhere where folks are actually using translation? Is there a safe use case? And so I got this example from San Jose. What was interesting about Wordly is they'll explain exactly where you can and can't use it, where is it safe to do. But then they have these 3 very simple templates. And so you look at the vendor review, you can see it specifically documents no Wordly customer data is ever used for training. We test all our models at least quarterly, so we're updating. This is also state of art. But what they do is they have a model for you, if you're looking at a vendor, to look at what are the questions we're supposed to be asking that we can ask our vendors to do. and they give you, again, a framework to start governance that goes beyond saying it's too scary or oh, we can't do it. We're afraid of losing jobs, all of the reasons not. So I'm sort of zoomed through this presentation. I guess I'm supposed to have a lot more time. I'm looking to have more dialogue. But if I said, what's the takeaway from this? I would say, number one, what I've learned from being a leader at an AI company, no one is actually an AI imposter. All of our software developers, they may have had a great technique for developing an agentic system 6 months ago. The framework changed. They had to relearn their frameworks, right? So the managers, the leaders, even the technologists, it's changing so fast that no one is an imposter. The second is, if you want to be a smart AI manager, you have to start as a smart AI user. So you need to spend the time to understand that jagged frontier. You need to understand where is this useful and not. You need to also figure out which tasks work and don't work. And this is really best done not alone, but by talking with others who are peers, and learning from them, finding your gurus, and then start with simple frameworks. I love the Gov AI framework. It is not healthcare specific, but it gives you some very easy ways to create a policy, to document what's happening in terms of AI vendors that you might be working with. And lastly, I will tell you, AI team members, I do think are part of the future. You could see that company I was at. I can tell you some of those products worked fantastic. We're working with design partners to make better. I believe that in the safety net, between staffing and budget challenges and a pro AI federal government, it's going to be hard not to leverage AI team members. So the question I think then is, what steps are you going to take next? And within that world, I think there's options, right? There's personal use experience. There's going after more gurus and groups, taking an AI inventory. There are a lot of different steps that you can take, and that I think get us started. And so that is my brief talk. I would love to have a dialogue now, if folks are awake and have had their coffee.
We have a couple of comments and questions in the chat, so I think we can get into the dialogue. So
Right.
let's actually start with Sonia's question around do you want to actually speak to your question, Sonia? I think it's a great one.
Sure. Hi. Thanks, John. I really appreciated the overview and exploration. Always glad to hear you speak. I am curious around this kind of chicken and egg situation that we have. One of the criticisms of using AI specifically in healthcare is that the data that it's trained on is not representative of our populations, especially when you talk about marginalized populations. But yet, you just said, John, a true point, which is, hey, we don't want to let our actual data get used. And it's, okay, how do we bridge that? And it kind of leads into my second comment, which was around trust, right? How do we build trust around the use of AI? And a lot of times people don't want the data used because they don't know what's happening with it, or there's a lack of transparency. So I guess I kind of threw in both of my questions there for discussion because one, and I apologize, I'm going to have to hop out here in a minute, but I'm curious if anyone has heard anything about the first, paradox. How do we bridge and get models that are built on real world data while building trust and fostering kind of an environment that says, hey, we're going to use this, but in this way to make it better for you. So I open that to everyone.
I I'm going to try and take a first answer, and then I will tell you, if I was a data scientist or building a product myself, one of the key things people do is they oversample certain data sets to try and make it more representative. That's messy. It doesn't always work beautifully, and it actually creates some silly things such as what Google was doing earlier. But it is one of the answers that folks can do. And the other, I think, more broadly, is to say this is a governance issue where we need to be the adults in the room on saying we can't use this for this. And I think if you look at the San Jose City's governance documents on Wordly, and they look at, okay, this may not be perfect, but are we giving more access to folks because we're using this tool? It's stunningly yes. This is a perfect use case where using this real-time AI tool is a game changer for our non-English speaking people to participate in government. So we have to do this. And I think that it really does come down to governance choices and being the adults in the room. There are ways to do it, but it's all happened so fast. It's not an evidence-based proof. It's more heuristic policies. I want to hear other folks on this as well.
John, I'll chime in. Awesome. I'm very excited we're having this conversation. I did join RMAG, and I'm very excited to see AI in healthcare subchapter. I heard NVIDIA and Oracle are looking to sponsor that.
There's a talk. Well, so they're giving a talk, which is a one-time talk, but it's not necessarily. We'll talk more about how to build this as a thing, because it needs to be a thing.
Right. And that's kind of big. My like high level pictures. How do we continue to build the community and the momentum? Because I think that's how we ensure that everyone feels accompanied and their voices are heard. So you don't have to understand what hallucinations or overfitting training on for models. Like at some point there needs to be signal from the noise, and there is a lot of hype. And so folks are not sure where they should land. And there's a group called Chai that I've been following, chai.org. I don't know if you're familiar with that. And they just released a AI registry where they're actually starting to vet model cards of specific AI models. So this is all evergreen or ever evolving. It's changing very dynamically. As John's saying, we're all beginners, even if we're not new to technology, perhaps. But I don't know if you have thoughts on that, John, but some sort of industry consensus on what's safe AI, safe uses of AI, and best practices for framework, adoption of these solutions.
So I'll tell you a few things. One is that talking to people who are actually talking to someone who is as close to your peer is far more helpful than a lot of webinars are filled with people who are going to give you the hype about how great their company are. Having worked at one of these companies, I understand there's a drive to prove your value and it's all lights and whistles. RMAG has been the best for me because it started 2 years ago. They have 2,500 people, and a lot of them are folks who are saying, I am using this for this. This worked and this didn't work. And so being grounded with real humans who are going to give you straight talk is critical. And I think doing that here in Colorado in health, got to do that. Second, there are always organizations that are willing to give you an accreditation for your, you pay them a little money and they'll say, this is good for this or good for that. Those are great organizations. I'm glad they exist. My experience is that like a group like govai.org, that group is publishing their own, like if one government does the assessment, they're saying, here's my assessment. Here's how we're using it. And it's very transparent instead of being a paid vendor getting assessments. So I have a bias towards that approach because it's sort of an open source approach, but I think it's very important.
Yeah, absolutely agree.
Paul?
Hey, John, this is really great. I had a question. It's more about how providers might use AI. And about a year ago, I was interviewing a bunch of providers about AI, and they were very skeptical and hesitant. But the one thing that kept coming up as a positive was they felt they're just overwhelmed with reading notes. They can't keep up with all the patients. And so they were very interested in this human in the loop, like you were saying, that I don't completely trust it, but I want to be in the loop. I need to be in the loop, and actually be the one to call the patient, not have AI do it. But they were very interested in how can I use AI to like summarize all these notes so I don't have to do all this reading, and also triage. Like if I've got 2,000 patients, I want to use AI to bring to the top of my inbox which ones I need to focus on. And so I'm just curious. That was a year ago. I don't know if it's changed a lot, but I'm just curious what your thoughts are on like provider trust and using.
So first I'll say, when Denver Health started using an AI scribe, it was a game changer in terms of provider burnout. A good friend of mine is the leader in infectious disease. And for her to not have to have her laptop in front of her when she was talking to her clients, to be able to bring her phone into the room and say, this helps me such that I can listen to you with my note taking, put it down. Yes, you're recording it, but the way it works is it's not creating a permanent record. It is strictly transcribing into the EMR. I mean, it's 2 hours less of those providers' time almost every day. It's been a game changer. And does it hallucinate? Sometimes, yes. People with unfortunately, thick foreign accents, especially, that can be mistranslated. But still, what she says is it summarizes better than anything else. It doesn't write down my personal opinions. It can tell the difference between my personal opinions versus the patient's. And it also says, listen, I'm not going to take every detail of this patient's personal comments, but I'll mention which pieces are clinically valuable. Amazing game changer. And I actually think there are a lot of places where AI can be used to reduce burnout and to upskill people. And I think especially in the safety net where staffing is so painful right now, there's amazing opportunities to do this. On the where to find problems, I think that is more difficult, I guess. We went through a whole pop health explosion to try and say we're going to solve this, and I'm not sure where that came out, I guess I'll say. That said, I'm a big believer in finding those folks who are out of the system and trying to pull them back. Like that lost patient example that I provided, there are a whole bunch of folks who are getting zero care. And if there are ways that we can actually engage or re-engage folks, it can help overall health to find problems. So most frequently, it is those folks who are out of the system who are going to be repeating into the ERs, et cetera. Anyways, a couple thoughts. I welcome other folks.
I'll say, Paul, I think that as far as the question around like, do we still see providers who are not trusting AI? I think the answer is yes. I think we're seeing a lot of providers who are, I think there are a lot of systems that are using AI, and providers themselves aren't actually aware of all of the aspects of what is being used. So some of it is just a bit of a black box of like, I don't know where AI is being used, and therefore I am feeling untrusting of it. So there is some pieces that systems and hospitals, et cetera, need to be better about explaining, describing, and understanding what AI is being used and how it's helping. And there are also pieces and places where individual patients are actually coming in distrusting of AI, making it harder for providers to actually then gain their own trust in the system when they're getting the pushback from both sides of that equation. So I think that's the other side of it that we need to explore even more, is how, not just how we're building provider trust, but actually how we're building patient and community trust around this as well. So that providers themselves aren't getting stuck in the middle of decisions about using AI and a lack of trust from the community side, making them either an advocate for something they don't know or understand, or kind of stuck in that middle spot. I think that's one of the places that we're getting and hearing tensions exist, and how do we kind of know and understand how to address both sides of that.
Yeah, I think that human in the loop, it's amazing when I started using it, I learned about that term, I started using that term, their level of anxiety came down because they want to make sure that they're not cut out of the loop, and then something bad happens. So I think that was very interesting. Like, look, this is going to help you with your workload, with your, keeping up with your patients, but at the end of the day, you're still the doctor. You still make the call, and you've just got a very efficient advisor now helping you do that. So
One thing I would say is, if you wanted to do a follow-on event, understanding how Denver Health rolled out its Nabla AI scribe, very interesting. Like that's why I made a phone call to my friend and had a full hour conversation with her on what does it do in the EMR, what does it do for notes, and how do you introduce it to a patient such that the patient says, oh, okay. What she's found is, just about all of her patients say, oh, great, I can talk to a doctor instead of seeing someone type. Like, yeah, this is good for me. Like I don't go to see a doctor such that I see someone who looks like a receptionist. So they haven't seen a ton of pushback, but they did go through a whole training on here's how you talk about to patients, here's how to think about it, and to remember, these are places where you need to watch out, especially.
A great example of community engaged and community centered implementation, which is not always the case. Gary had a question in the chat. How is Gen AI being used for actual behavioral health care these days? CBT was the last best use case I had heard of.
I am not an expert on that topic. I certainly have seen solutions out there touted as, being great. That makes me anxious. I can't really comment more beyond that. Yeah, I don't know if folks know more about that than I do.
I might add a little note. I have discussed with a few psychotherapists in Boulder. So I'm actually in Boulder, Colorado. So we're neighbors, John, and some of you guys in here. So would love to meet in person too, outside of the Zoom. But I met with some psychotherapists in the area just to kind of understand kind of the problem space. And they've been talking about using different EHRs that have like DAP note integration, because they don't use SOAP notes, DAP notes. So I'm learning as I go, but they did not particularly like the existing solutions and for AI, and they were very reticent to integrate AI scribes because of the sensitive nature. And for them, it's very high risk to provide a false positive for their clients. And they usually have a handful of clients, so they do put in the work. That's a large part of their time that they're willing to do themselves and not delegate. So if they use AI beyond that, I'm not sure. But as far as an AI scribe during consultations, I've sensed, kind of a reluctance to fully embrace.
Ah, that's interesting. Yeah, yeah. I could ask my friend on that. I didn't discuss that. I mean, I think that, frankly, in the safety net, every conversation, there's a behavioral health aspect to it, right? I mean, that is part of the job. And it is certainly being collected by the AI scribe that Denver Health is using. But when it's just a session, are there different guidelines? I certainly understand the unique regulatory world of behavioral health. So, but I can't answer that. That sounds like an important one to cover, though.
Yeah, noted, Gary, as something we need to dive into for a future conversation for sure. Any other questions or discussions or?
Yeah, I'm happy to talk about some of the work I've done, the frameworks and gurus. I can send you in my slides, you'll see links out to GovAI and ONC's release of the FAVES framework. I don't know if other folks have seen frameworks that they think are helpful for evaluating AI vendors in an early stage like now. I'd love to hear about it. It's so early, and that's the thing, right? Is that the wave is big, the volume is so high that I think folks just have trouble parsing it out and reducing it to concrete steps. And that was my goal here, was to say, take small concrete steps that are real that you can do today. That's why I picked the city of San Jose. Was my guess is they had to do something because there was too much AI in their system, and they had to say, listen, I can't not have a framework, right? And it's those folks who are forced to take the step earliest that might at least give you an idea of what to do instead of doing nothing. Yeah. Anyways, happy to do more. I think that doing something here in Colorado around this, there's a movement potential here that we all could get going on, and that I would love to discuss further as well.
Absolutely. I think that's very exciting, John. I just dropped in the chat too. I don't know much about the Chai folks. I've just been following them, and they are issuing I don't know the level of like scope. It does sound like they're a national group. I don't know if anyone has experience with them, but
I have heard of Chai before, and I
and they have,
need to look at who the leaders are.
but adopting something like that at the state level might be cool to start discussing how to come up with some sort of governance that might kind of look, rhyme with what they're doing. So having general consensus would be nice. So it's if I change states or with the national or local level, they rhyme, right? They echo kind of similar tenets, so we can assemble a set of best practices. So exciting developments.
Are there early provider adopters in Colorado? Jeffrey's asking.
Adopters of what? I guess I'm asking.
Just
of Chai?
Who's adopting AI in their provision of care? You mentioned Denver Health. I'm wondering if there are any others.
I mean, I think there's dozens. I mean, for example, Jeffrey, you and I both probably know Andy Draper, CIO of HCA. I can name a dozen solutions that the big national health systems are using. Viz.ai was one, certainly. Oh gosh, there's a company called Eon Health here in Colorado that's been used to identify secondary findings in the EMR. You can go on and on. I mean, the list of vendors is quite broad. I think the nice thing about these big national hospitals like HCA, they're certainly there's a whole governance structure, and I think that's what's different for the safety net is that they don't have a structure to sort of go through these vendors, and that's why I was sort of taking a different approach there. But it's broadly used, yes. It's already, and it really started from these early AI solutions, like I said, like the earliest ones really were the radiological and sort of digital analytics that went through the FDA approval process. They were really sort of the pioneers of this.
the state of Colorado just went through a whole process to determine and understand which AI they would and would not allow. And I think just last week said that they were allowing staff to use Gemini, and when I had conversations with some folks over at the state health department, for example, they said, that's great, but we don't have the governance in place enough to feel confident about using that for aspects of public health data, et cetera, that they feel is safe and protected. So I think though it's rolling out at like the state level, the trust and ability to use it I don't think they're quite there yet. But yeah, just as another, like a larger example of a government agency rolling it out.
I could endlessly. I think that Ethan Mollick is going to have business for a long time, just teaching folks how to become the human, just telling stories from all of his consulting he's done already. I have led that book group. If you want to actually do something to help your community or folks in your company, have everybody read Mollick and talk about it. It is a very easy way to get started. Hands-on activities and discussions really are just so much more helpful than, I can say I'm an AI expert. It does nothing versus having conversations where you say, listen, how do we help each other actually navigate this specific issue? Just to put this presentation together, for example, I have a friend who also is doing healthcare and AI and was able to say, you should mention this. So it is how things get done. I am somewhat suspect of national groups, I'll just say, because it's hard to generalize across a broad population. It's easier to look at domains that and folks that So I sort of believe in building concentric circles to get started. Anyway, it's fascinating that the state is allowing Gemini, though, huh?
Yeah, I just heard that in a call I had earlier this week. So it was surprising. There's been so much hesitancy on the state level. They've been Google based for a while, so the choice is not overly surprising. But all right, we are going to do a quick feedback survey. So Felicity's going to put that in the chat. If you don't mind giving us a little bit of feedback, that'd be great. Otherwise, know this is the beginning of a lot of conversations like this. Our next one, we are going to have the Office of eHealth Innovation giving us an update on so they released their draft roadmap in January. They are going to be releasing the final roadmap after commentary by early April, and they'll be presenting to us in partnership with PrimeHealth on what they have done and what the updates to the Office of eHealth's Innovation roadmap is. And I'm excited to dive into that and get feedback and ongoing conversations around that with our PrimeHealth community to think about how we can support and work together with OHI on implementation of their roadmap. So do provide a little bit of feedback. We've got the questions should be simple and easy and quick. And I want to say thank you so much, John, for this great conversation. I know you and I have talked about this is the first of many. I expect and hope that we will have continuing and ongoing conversations about AI and specifically implications and work within the safety net. So thank you all. If you have any further questions, conversations, comments, don't hesitate to reach out. We did record this. We also will have slides if anyone is looking for them. So thank you all, and have a great rest of your day.
Thank you.
Thanks.